Today we are going to complete the autonomic nervous system. Okay, already combined drag effect, all these things already completed. So now we are going to complete the autonomic nervous system. Okay. Wait a second, please. I got a call. So, hi everyone. Actually, suddenly I got an urgent call. One of my friend fall from bike and he fractured his and he broke his hand. Okay, so it's okay. Let's complete the autonomic nervous system as soon as possible. Then I'll go to the hospital. Okay. So first of all, autonomic nervous system. What does autonomic nervous system mean? The nervous system in which the mainly activity will be autonomic. There is no this activity is not regulated by any will. They are automatically taking place based on the surrounding and situation. Okay, so the nervous system is divided into two types mainly. They are central nervous system and peripheral nervous system. This central nervous system is consist of brain and spinal cord, whereas the peripheral nervous system is again divided into two part. One is autonomic nervous system and one is somatic nervous system. Okay, one is autonomic nervous system, one is somatic nervous system. This autonomic nervous system also includes the anterior nervous system. It also includes the anterior nervous system, whereas somatic nervous system includes the skeletal nervous system. Now, the most important point to remember here is that this autonomic nervous system is divided into two types again. They are sympathetic nervous system and parasympathetic nervous system. Okay, the function of autonomic nervous system. So, autonomic nervous system, first of all, it increases the force of contraction of heart, which will lead to the cardiac output, increase in cardiac output. Next, it involves the energy metabolism. Next, it causes the smooth muscle contraction and relaxation, and it also regulates the neurotransmitter release. Okay, now you have to remember that the sympathetic, what is the difference between sympathetic? Okay, we will see the difference between sympathetic and parasympathetic nervous system. Before that, we have to remember one thing, that in the, what is ganglia first of all? Ganglia are the group of cell bodies. Ganglia are the group of cell bodies. Now you will see two ganglias are there. One is preganglia, one is postganglia. Postganglia is the later part after a ganglia, and preganglia is the former part before a ganglia. So these are the preganglia part, these are the postganglia part. In between there will be a ganglia. Ganglia means cluster of cells, or you can say a group of cells. Okay, now see what will happen. A preganglionic neuron always release or secrete acetylcholine in both sympathetic and parasympathetic condition. Okay, and postganglionic neuron uh, releases the neurotransmitter based on the condition. If the condition is sympathetic or adrenergic condition, in that case noradrenaline will release, and if this condition is acetylcholinergic or parasympathetic condition, at that time acetylcholine will release. Okay, the organs are covered by different types of layer. These layers have different name based on the different location. If we see, then peritoneum is actually the covering of intestine, and pericardium is the covering of heart. Okay, so now what is the difference between the sympathetic nervous system and parasympathetic nervous system? The difference between sympathetic parasympathetic nervous system are, and a sympathetic nervous system is also called adrenergic nervous system. The main neurotransmitter released in the case of sympathetic nervous system is noradrenaline. Okay. Next, it is mainly activated during flight and fight. So it is a response in the case of flight and fight. Simply, you can remember that the sympathetic nervous system or adrenergic nervous system is activated when there is any stressful situation. So during the stressful situation, body will prepare itself to fight against that stressful situation and save the body. Are you getting my point? So next is parasympathetic nervous system. This nervous system is also called cholinergic nervous system. The main neurotransmitter released in that system is acetylcholine. That is acetylcholine. Next, it is mainly activated during rest and digest. So it is also called rest and digest response. Okay. Next is, it counteracts the action of sympathetic nervous system. Okay. Now we will see ANS consists of preganglionic and postganglionic neurons. I have mentioned 2-3 minutes ago. So ANS consists of preganglionic and postganglionic neuron. Preganglionic neuron secretes acetylcholine in both sympathetic and parasympathetic condition, whereas postganglionic neuron secretes noradrenaline in the case of sympathetic condition, and also acetylcholine in the case of parasympathetic condition. Okay, see, it's written here. The preganglionic neuron and postganglionic neuron secretes acetylcholine in parasympathetic nervous system. Next, exception. Preganglionic neuron and postganglionic neuron both secretes acetylcholine in the sympathetic nervous system. In the sympathetic nervous system, you have to remember that in salivary gland. So the most important point here is that in the sympathetic nervous system, both preganglionic and postganglionic both will release acetylcholine, but in where? In salivary gland. In salivary gland. Okay. Next, sweat gland and blood vessels only sympathetic innervation. So sweat gland and blood vessel only sympathetic innervation, and only parasympathetic innervation is present in lacrimal gland and ciliary muscles. Okay. Next, bronchial smooth muscle doesn't consist of sympathetic nervous system, but consist of adrenergic receptors which are activated by circulating noradrenaline. Ultimately, the adrenergic receptors will be present. Where? On the different bronchial smooth muscles. On bronchial smooth muscle, adrenergic receptors are present. So what will happen? The circulating noradrenaline or circulating adrenaline will affect on that receptors mainly. Okay. So bronchial smooth muscle do not consist of any sympathetic neurons, but consist of adrenergic receptors, which are activated by circulating noradrenaline. So here, circulating noradrenaline and adrenergic receptors, these two are important terms. You have to remember. Okay. Next, this is the ganglion part. This is the ganglia. So after the ganglia is postganglia. Before the ganglia is preganglia. So preganglionic neuron is the neuron which is present before ganglia, and this neuron starts in the brain, and from brain it ends up to the ganglia. Whereas postganglionic neuron starts from the ganglia and ends up to the organ. Okay. Now this preganglionic neuron always release or secretes acetylcholine, whereas this postganglionic neurons secretes acetylcholine also and noradrenaline also based on the situation. If it is adrenergic condition, then it will release noradrenaline, and if it is cholinergic situation, then it will secretes acetylcholine, ACH. Okay. So it's written here. Preganglionic neuron release acetylcholine, then ganglia will come, then postganglionic neuron secretes noradrenaline. In the which situation? In the sympathetic nervous system or adrenergic situation, that is stressful situation. Again, preganglionic neuron secretes acetylcholine, then ganglion, then postganglionic neuron also secretes acetylcholine. In which condition? In parasympathetic nervous system or in restful situation. Next, noradrenergic non-cholinergic neurotransmitters present in ANS. Okay. So what are the different types of peptide and non-peptide neurotransmitter? We have to see. So peptide neurotransmitter are these right side, peptide neurotransmitter. They are non-peptide neurotransmitter. Example of non-peptide neurotransmitter are dopamine, GABA, substrate P. What is GABA? GABA is the gamma aminobutyric acid. So dopamine, GABA and substrate P are the non-peptide neurotransmitter, whereas peptide neurotransmitters are neuropeptide Y, then vasoactive intestinal peptide, then calcitonin gene related peptide, and vasoactive intestinal peptide and neuropeptide Y. Okay, am I clear? Next we will see the sympathetic nervous system. This is the overview of the sympathetic nervous system. This is also adrenergic nervous system. In this, what will happen? The main neurotransmitter in the case of sympathetic nervous system is noradrenaline. The main neurotransmitter is noradrenaline. The precursor for the noradrenaline is dopamine. So from dopamine, noradrenaline is produced or synthesized. Next, adrenaline secreted from the adrenal medulla. Adrenaline secreted from the adrenal medulla. Adrenaline secreted from the adrenal medulla. Whereas isoprenaline is the synthetic catecholamine. Isoprenaline is the synthetic catecholamine. What does catecholamine mean? Catecholamine means you will see a benzene ring like this. In this benzene ring, two hydroxyl group will be present on the adjacent carbon. This is called catecholamine. Sorry, this is called catechol moiety. This is catechol moiety. If you see any carbon chain along with ammonia group or NH2 group, then this is called catechol amine. This is called catechol amine. Okay. Next, we'll see the other parts. That is, what are the example of catecholamine? The example of catecholamine are dopamine, adrenaline, noradrenaline, isoproterenol. So dopamine, adrenaline, noradrenaline, and isoproterenol all are the example of catecholamines. Okay. Next, synthesis of noradrenaline. So how does noradrenaline synthesized? Inside the adrenergic neuron, what will happen? The tyrosine, an essential non-essential amino acid, this tyrosine will convert into dopa in the presence of enzyme tyrosine hydroxylase. This dopa again converted into dopamine in the presence of enzyme dopa dehydroxylase. This dopamine will convert into noradrenaline in the presence of enzyme dopamine beta hydroxylase. Okay, then this noradrenaline will convert into adrenaline in the presence of enzyme phenyl N-methyl transferase. Now the most important point that you have to remember is that this tyrosine hydroxylase is inhibited by alpha methyl dopa. Tyrosine hydroxylase is inhibited by alpha methyl dopa. Again, that dopa decarboxylase is also inhibited by carbidopa. Dopa decarboxylase is inhibited by carbidopa. Next, the dopamine beta hydroxylase is inhibited by, it is not inhibited. Yes, coparcylating agent and disulfiram. So see there. Okay, next you have to remember these all things happen in the adrenergic neuron. Already I have mentioned these all things happen in the adrenergic neuron. Ultimately, synthesis of noradrenaline takes place in the adrenergic neuron. Now a simple trick I'll tell you that one second. This noradrenaline again converts to adrenaline. This noradrenaline again converts to adrenaline in adrenal medulla. This part takes place in the adrenal medulla only. Okay. So why this adrenaline? That's why the adrenaline is released from the adrenal medulla also. Now a simple trick I'll tell you. If you it will make you easy to remember the different example of essential amino acid. What are the different example of essential amino acid? They are try the VIP mole. Tri means tryptophan, the threonine, VIP valine, then isoleucine, then phenylalanine. VIP mol. M means methionine, L means lysine, L means leucine. Okay. Next, release of noradrenaline. So how does noradrenaline released? So what will happen? In the adrenergic neuron, you will see a channel in which the entry of calcium will takes place due to the depolarization. So when the stimulus will come from the neuron, from the axonal part, when the stimulus will come, it will cause the depolarization. Okay, so due to that, what will happen? The calcium entry will takes place. When the calcium will enter inside the vesicle. So what is vesicle? Vesicle is the storage vesicle. Storage vesicle is the store where the noradrenaline will be stored. Okay. Now this calcium entry, in this calcium is the triggering point. Listen, this calcium is the triggering factor for release of noradrenaline. This calcium is the triggering factor for release of noradrenaline. So when this calcium will enter, what will happen? It will bind to, it will show its action, and due to which what will happen? This noradrenaline will come and it will release. Okay, so these noradrenaline are synthesized from tyrosine. From tyrosine, noradrenaline are synthesized, and then these noradrenaline are stored in the vesicles. Okay. Now what will happen when the noradrenaline will release in the synapse. This part is called synapse. So when the noradrenaline will release in the synapse, the amount of noradrenaline will decrease, or it will be maintained in 2-3 ways. The first and foremost way is the automatic reuptake mechanism. So what does this automatic reuptake mechanism means? There will be a alpha 2 receptor present on the presynaptic neuron or presynaptic nerve ending. Okay, here the alpha 2 receptor will be present, and it will reuptake maximum of the noradrenaline from the synapse. Also some noradrenaline will takes place in the metabolism, that is metabolism of noradrenaline will takes place. This metabolism of noradrenaline is taking place in the presence of two enzyme is called MAO and COMT. So what is MAO? MAO is monoamino oxidase, and what is COMT? COMT is catechol or methyltransferase. Okay, so these are mostly secreted in the adrenergic synapse, and when the noradrenaline will undergo metabolism, it will convert into vinyl mandelic acid. So vinyl mandelic acid is the final metabolite of the noradrenaline. Okay, next some noradrenaline will also absorbed back in the adrenergic neuron through the carrier protein. Okay, so three ways the noradrenaline level will be maintained in the synapse. Number one way is that alpha 2 receptor. Number two way is metabolism, and number three way is reuptake through the carrier protein. Okay, so after the metabolism, the noradrenaline will convert into vinyl mandelic acid in the presence of two enzymes. What are they? MAO and COMT. So what is MAO? MAO is monoamino oxidase, and what is COMT? COMT is catechol or methyl transferase. Okay, so you have to remember that. Next, some noradrenaline will go and it will bind with the postsynaptic neuron. So in the postsynaptic neuron, there are different receptors present. That is, alpha 1 receptors are present, and other receptors will also be present. So when the noradrenaline will bind with the postsynaptic neuron, what will happen? Phospholipase, it will generate the secondary messenger. And what are the secondary messenger? They are IP3 and DAG. So what is IP3? IP3 is ionosyl triphosphate. Ionosyl triphosphate. And what is DAG? DAG is diacyl glycerine or diacyl glucosamine. You will see there, it is written here only. Okay, we will find later. So this part is the post synapse part. Ionosyl triphosphate and diacyl diacyl glycerol, yes. So after the formation of the secondary messenger, what will happen? The calcium level will increase inside the nerve. When the calcium level will increase, what will happen? It will cause the depolarization, and this depolarization will further lead to the excitation inside the nerve signals. Okay, so this part is called adenylyl cyclase CMP. Again, in the other receptor, what will happen? It will it will activate the adenylyl cyclase. After activation of adenylyl cyclase, CMP level will increase. When CMP level will increase, again it will show its pharmacological response. Okay, now the calcium entry in the presynaptic neuron is the main triggering factor for the release of noradrenaline. So calcium entry in the presynaptic neuron is the main triggering point or triggering factor for the release of noradrenaline. Okay, release of noradrenaline, presynaptic neuron. Now, noradrenaline level in synapse are regulated by metabolism. Number one, by metabolism. Number two, by action of noradrenaline on the presynaptic alpha 2 and reuptake mechanism. So reuptake mechanism by carrier protein, and alpha 2, it is also causes automatic reuptake mechanism. So presynaptic alpha 2 adrenergic receptor are inhibitory and decreases the release of noradrenaline. So why it decreases the release of noradrenaline? Because it is an inhibitory receptor. Next, the metabolism of noradrenaline. So metabolism of noradrenaline takes place in the presence of two enzymes I have mentioned earlier. What are they? They are MAO and COM. What is MAO? MAO is monoamine oxidase, and what is COM? COM is catechol-O-methyl transferase. Okay, so it is metabolized by MAO and COM. MAO and COMT. Okay, next, noradrenaline in the presence of catechol-O-methyl transferase, it will convert into normetanephrine. Again, this normetanephrine in presence of monoamine oxidase, it will convert into vinyl mandelic acid, which is the major metabolite of the noradrenaline. Again, in another pathway, if this noradrenaline is binding with the monoamine oxidase, then what will happen? The monoamine, after the binding with monoamine oxidase, so like in the presence of enzyme monoamine oxidase, the noradrenaline will convert into dihydroxy mandelic acid. And then this dihydroxy mandelic acid, again in the presence of catechol-O-methyl transferase, it will convert into vinyl mandelic acid. And this vinyl mandelic acid is the major metabolite of the noradrenaline. And vinyl dihydroxy mandelic acid is the minor metabolite of noradrenaline. So you have to remember that. Next, both are excreted through urine. What these both mean? These both means the dihydroxy mandelic acid and vinyl mandelic acid. Both dihydroxy mandelic acid and vinyl mandelic acid are excreted through urine. Next, adrenergic neuron system. Now we will see the adrenergic nervous system. Before going to adrenergic nervous system, you have to understand that where the alpha 1 and alpha 2 receptors are present. So alpha 1 receptors are present on the vascular smooth muscle, and alpha 2 receptors are present on the presynaptic neuron. This alpha 2 receptor acts as an inhibitory receptor, wherein it will show its inhibitory action, whereas alpha 1 shows its stimulatory action or excitatory action. Okay. Now this adrenergic nervous system. So adrenergic nervous system, in this what will happen? The noradrenaline is the adrenergic neurotransmitter, which will bind to the adrenergic receptors. These adrenergic receptors are also called G protein coupled receptor. So this G protein coupled receptor are, why it is called G protein coupled receptor? Because the receptor is coupled with the G protein. So what is this G protein means? Receptor is coupled with the G protein. What does this G protein means? G means guanine. G means guanine. So the receptor is coupled with the guanine protein. Okay, now let's see the structure of G protein coupled receptor, how it is formed. For example, this is the cell membrane. This is the cell membrane. On this you will see a receptor will be present. This is the external domain. This is the external domain. Okay, wait a second. So there is the external domain, the receptor. This receptor will enter inside the cell 1, 2, 3, 4, 5, 6, 7. 7 times. It will pass through the membrane 7 times. And that's why it is, this is the external domain, this is the internal domain, this is the intermembrane domain. So that's why it is called also serpentine receptor, and sometimes it is also called 7-pass receptor. Why it is called 7-pass receptor? Because it passes through the membrane 7 times. See, it passes through the membrane 7 times. And second point is that it looks like snake, so it is also called serpentine receptor. Okay, now in the adrenergic nervous system, the adrenergic neurotransmitter, that is noradrenaline, will come and bind to the adrenergic receptor. These adrenergic receptor are also called G protein coupled receptor. Why they are called G protein coupled receptor? Because these receptors are coupled with the G protein. These G protein are guanine protein. So the receptor will be like this. See, this is the cell membrane. On this, the receptor will be like this. Yes or no? But it will come. So 1, 2, 3, 4, 5, 6, 7. After that, it will be like this, na? So this is the internal domain. This domain is again binded with the G protein. So here you will see a G protein will be connected like this. This G protein is having 3 parts. One is called alpha, one is called beta, one is called gamma. So alpha G, beta G, gamma G. From that, alpha G will be separated from beta and gamma G. So what is this G mean? G means guanine. Okay, now we will see in front. We are proceeding towards this only. So before going to that, we must know that the adrenergic receptor are of 2 types. One is alpha receptor, one is beta receptor. Alpha receptor and beta receptor. These alpha receptors are again of 2 types, alpha 1 receptor and alpha 2 receptor. Alpha-1 receptors are mainly present on the vascular smooth muscle. That is, they are present on the blood vessels. Smooth muscle of blood vessels. So here you will see different smooth muscle are there. These smooth muscle are having alpha-1 receptor. What type of receptor it is? It is an excitatory receptor, and it will show excitation or it will show contraction. This contraction of the vascular smooth muscle will lead to the vasoconstriction. Okay, now we will see about alpha 2. Before going to alpha 2, let's read what is written here. So alpha 1 receptor is a stimulatory receptor. Alpha 1 receptor is a stimulatory receptor. Okay, and it is activation of phosphorylase C. So on the activation of alpha 1 receptor, what will happen? Activation of phosphorylase C will takes place, which will lead to the increase in secondary messenger, that is IP3 and DAG. So what is this IP3? IP3 is called ionoacetyl triphosphate. And what is the DAG? DAG is the diacyl glycerol. Okay, so when the IP3 and DAG level will increase, when the IP3 level and DAG level will increase inside the nerve, which type of nerve? Adrenergic nerve, or inside the smooth muscle cell. Inside the smooth muscle cell, what will happen? Entry of calcium will takes place. Due to the entry of calcium, what will happen? The calcium ion level will also increase. When the calcium ion level will increase, it will causes the positive potential inside the cell. When the positive potential inside the cell, like positive ion presents inside the cell, concentration of positive ion will increase. What will happen? It will be positively charged. So that is called positive potential. When inside the cell positive potential, outside the cell negative potential, what this condition is called? It will lead to depolarization. When depolarization will takes place, further excitation of the cell will also takes place. That's why alpha 1 receptor is also called excitatory receptor. Okay, and it is also called stimulatory receptor. Now in contrary, we will see alpha 2. Alpha 2 receptor is also called inhibitory receptor. Why it is called inhibitory receptor? Because it causes the inhibition of the release of neurotransmitter, that is acetylcholine, that is noradrenaline. So this is called inhibitory receptor. So inhibits the adenylyl cyclase. That what will happen? Decrease the CMP level. When CMP level will decrease, potassium permeability will increase. When potassium permeability will increase, potassium entry inside the cell will increase. When the potassium entry inside the cell will increase, what will happen? It will cause the hyperpolarization, and due to which what will happen? The inhibitory noradrenaline release. Like release of noradrenaline will decrease automatically. Why? Because the cell will become hyperpolarized. So when the cell is become hyperpolarized, it is active or inactive. Now it will become little bit inactive. That means it is not stimulatory or not excitatory. So it is inhibitory. And inhibitory means it will not further show its activity, stimulatory activity. Now we will proceed towards the beta receptor. So beta receptor are of three types: beta 1, beta 2, and beta 3. Beta 1 is mainly present characteristically, specifically, it is beta 1 is present on the heart only. Beta 1 is present on the heart. So anything we are doing with the beta 1 receptor, it will definitely and directly it will affect on the heart. Which heart, which mechanism, or in which action of heart? So it will either cause the contraction of heart or the rhythm of heart. Mainly it affects the contraction of heart. Either it will increase the contraction or it will decrease the contraction. When the beta 1 receptor is activated, it causes the increase in the contraction of heart. Again beta 2 is characteristically present on the smooth muscles also, and bronchial smooth muscle. This beta 2 is also present on the uterine smooth muscle of uterus. These beta 2 are also present on the bronchial smooth muscle. So that's why if we do anything with that beta 2, either it will cause bronchodilation or it will cause bronchoconstriction. That's why salbutamol, which is a beta 2 agonist, selective beta 2 agonist salbutamol, this salbutamol is used in the case of treatment of asthma or COPD. What is COPD? COPD is the chronic obstructive pulmonary disorder. That is, in the pulmonary system, there will be some obstruction. So this obstruction, which is taking place during the respiratory system is together called chronic obstructive pulmonary syndrome. Okay, disease. Now beta 3, these beta 3 receptors are mainly present on the adipocyte cell, and it is also called adipose tissue. But if you say specifically, it is mainly present on the adipocyte cell. And what is its function? During any stressful situation or any dangerous situation, our body needs more energy to run or to fight, so that body can save itself. So I have mentioned earlier, this adrenergic system is all about the preparation of body against any stressful situation, so that body can save itself. Yes or no? Or so that body can fight against that stressful situation. At that moment, our body needs more energy. So what will happen? This beta 3 receptor, which is present on the adipocyte cell, it will cause the breakdown of the fat molecule. It will cause the breakdown of the fatty acid or fats, ultimately leading to the release of glucose inside the circulatory system. Okay, so these beta 1, beta 2 and beta 3 all are stimulatory of all are stimulating of adenylyl secretion. That is, all are stimulatory receptors. All are stimulatory receptor, and what they are doing, they are stimulating the adenylyl cyclase. And when adenylyl cyclase enzyme will activate, what will happen? CAMP level will also increase, and when CAMP level will increase, it will further cause the excitation. Okay. Next, we will see the adrenergic receptors properly in short and their activity. What are the activity of adrenergic receptors? So, the adrenergic receptors are of two types. What are they? Alpha 1, alpha receptor and beta receptor. Alpha is again of two types, alpha 1 and alpha 2. Beta is of three types. What are they? Beta 1, beta 2, beta 3. Yes or no? Now, this alpha 1 is excitatory. Already we know. We have studied just 3-4 minutes ago that this alpha 1 is excitatory or stimulatory. And it is also present on the smooth muscles. It is also present on the smooth muscles. Mainly which type of smooth muscle? On the vascular smooth muscle. Vascular smooth muscle means it is present on the blood smooth muscle of the blood vessels. Okay. So what does its function? Its function is smooth muscle contraction. Why contraction? Because it is stimulatory or excitatory. When stimulation will takes place in the smooth muscle, it will definitely lead to the contraction of the smooth muscle, except the GI smooth muscle. You have to remember, except the GI smooth muscle. That GI smooth muscle contraction is taking place in the presence of acetylcholine, and which receptor? That is muscarinic receptor. We will study after 5 to 10 minutes. We will go to that person also, and we will learn that. Next is alpha 2 receptor. This alpha 2 receptor is present on the presynaptic nerve terminal, and it is an inhibitory receptor. So what will happen? It will decrease the release of noradrenaline. It will decrease the release of noradrenaline. Next, beta 1. Already I have mentioned earlier that the beta 1 is characteristically present on the heart, mainly on the heart. So what will happen? If we increase the beta excitation, or if the beta receptor is stimulates, then what will happen? It will increase the force of contraction of the heart. So when the force of contraction of the heart will increase, what will happen? It will lead to the increase in cardiac output, and when cardiac output will increase, what will happen? It will lead to the hypertension. It will lead to the hypertension. Yes or no? Again, in the case of alpha 1 receptor, if alpha 1 receptor is activated, then what will happen? It will cause the smooth muscle contraction. When smooth muscle contraction will takes place, what will happen? See, this is the blood vessel. In the blood vessel, vascular smooth muscle will be present. Yes or no? So when alpha 1 receptor will be activating, what will happen? This vascular smooth muscle will also contract. When the contraction of vascular smooth muscle will takes place, what will happen? The blood vessel will also contract. So constriction of blood vessel will lead to the hypertension also. Okay. So beta 1 and alpha 1 are related to, they are related to hypertension. Now alpha 2 is related to the treatment of hypertension. Why? Because the contraction of that vascular smooth muscle will takes place when alpha 1 receptor is activated, and these alpha 1 receptor are activated by noradrenaline or adrenaline or dopamine, that is catecholamine. Okay, now what is the action of alpha 2? The action of alpha 2 is decrease in the release of noradrenaline. So when noradrenaline level will decrease, then less noradrenaline will come and it will bind to the smooth muscle of the blood vessel or vascular smooth muscle, which will lead to the decrease of hypertension. Am I clear? When less noradrenaline will come and bind, less contraction of the smooth muscle will takes place. When less contraction of the smooth muscle will takes place, less vasoconstriction will takes place. When less vasoconstriction will takes place, less hypertension will also occur. Am I clear? Okay. Next, beta 1 is also related to heart. So what will happen? Activation of beta 1 will lead to the increase in the force of contraction of heart. And when force of contraction of heart will increase, it will lead to the increase in cardiac output. When cardiac output will increase, it will lead to the increase in hypertension. Okay. Next, beta 2. Beta 2 is related to the, beta 2 is present on the mainly smooth muscle of the lungs, that is bronchial smooth muscle. So when bronchial smooth muscle will contract or it will relax, then what will happen? Either bronchodilation will take place or bronchoconstriction will take place. Okay, so mainly beta 2 is related to the relaxation of the bronchial smooth muscle and it will lead to the bronchodilation. Next, beta 3, already I have mentioned about the beta 3. What is the action of beta 3? Beta 3 will release, it will cause the lipolysis, that is breakdown of the lipids and fats. So what will happen? Ultimately, it will release the glucose in the circulatory system. In which situation? In any stressful situation. Okay. Am I clear? Thank you. Next, see smooth muscles. How many how many types of smooth muscle are present and where are they present? Number one, ciliary muscle. Ciliary muscle is present on the eyes. Next, GI smooth muscle. That is gastrointestinal tract smooth muscle. They are present on the GIT. Next, bronchial smooth muscle. Bronchial smooth muscle is related to which type of receptors? Is related to beta 2 receptor. GI smooth muscle is related to which type of receptor? GI smooth muscle is related to muscarinic receptor, M3 receptor. Okay, ciliary muscle is related to which type of receptor? Ciliary muscle is related to alpha 1 receptor. Next, it is also related to beta receptor and also related to muscarinic receptor. But this is not ciliary muscle is related to muscarinic receptor. Iris muscle. So radial iris muscle is related to muscarinic receptor. In that case, what will happen? Pilocarpine and physostigmine are used to treatment in the treatment of glaucoma. So why they are used? Because they are parasympathomimetics. Yes or no? So what will happen? For example, physostigmine is a indirectly acting parasympathomimetic. It will cause the inhibition or it will cause the inhibition of the cholinesterase activity enzyme. Ultimately, cholinesterase inhibitor. So when it will inhibit the cholinesterase, what will happen? Acetylcholine level will increase. When acetylcholine level will increase, it will cause the action, it will show its action on the radial muscle of the iris. So ultimately what will happen? It will lead to the flattening of iris. And when will flatten, at that time what will happen? The attachment or touch between the ciliary body and iris will become detached. It will become off and it will become detached. Due to that detachment, what will happen? The what it is called, lacrimal fluid, which are released from the lacrimal gland. So this lacrimal fluid will come out, and after that intraocular pressure will decrease. When the intraocular pressure will decrease, glaucoma will automatically be treated. Okay, so see there, what are the different types of smooth muscle? The different types of smooth muscle: ciliary muscle, GI smooth muscle, bronchial smooth muscle, blood vessels. Blood vessel smooth muscle is related to alpha 1. Bronchial smooth muscle is related to beta 2. GI smooth muscle related to M3, muscarinic receptor. Uterus is related to alpha 1 also, beta alpha alpha 1 also, beta 2 also. Beta 2 also. Next, bladder, urinary bladder also having smooth muscle, and this smooth muscle is called detrosior muscle. Okay, next, sphincter muscle is also present. So what are the sphincter smooth muscle? Number one is gastroesophageal sphincter, which is present on the above the stomach. Number two is pyloric sphincter. Pyloric sphincter present below the stomach. Next, you will see after the rectum, you will see anal sphincter, and also in the urinary bladder, you will see another sphincter. Okay, so these are the different types of sphincter which are having smooth muscles. They are called sphincter smooth muscles. Okay, now we will see the different location and their action of the adrenergic receptors. Okay, so the alpha 1 receptor which are present on the liver or the hepatic cell, they will cause the stimulation of, they will cause the increase in glucose gluconeogenesis. So what does gluconeogenesis means? It means the increase in the glucose production, maybe not from the glycogen but from the other biochemicals also or other metabolite. So this glucose level will increase, and again this glucose will be sent to the circulatory system. In which condition? In the stressful condition. So why? Because in any stressful situation or any stressful circumstances, our body needs more energy to prepare itself and fight against that stressful situation to save the body. So at that condition, in the circulatory system, we needs more glucose. Just try to understand that. In that condition, in the circulatory system, we needs more glucose. So some glucose will be sent from the liver. Okay, some glucose will be sent from the that fat cells that are called adipocyte cell or adipose tissue. So what will happen? Lipolysis will takes place, and the lipolysis will lead to the breakdown of the lipid and formation of glucose, and that glucose will be also sent to the, that are called free glucose, and it will be sent to the circulatory system also. And see here, glycogenolysis will also takes place, and this glycogenolysis also lead to the breakdown of glycogen. When glycogen will break down, what will happen? The breakdown of glycogen will form glucose again. The breakdown of glycogen will form glucose again, and that glucose will also be transferred to the circulatory system. Ultimately, in our circulatory system, the number of amount of glucose will be, a trace amount of glucose will be sent from different location, from mainly from three location. One is from liver. From liver, gluconeogenesis will takes place, and the glucose will be sent to the circulatory system. From fat cells or adipocyte cell, lipolysis will takes place, and the glucose will be formed, and it will also be sent to the circulatory system. And what will happen in the liver? Beta 2 receptor will cause, so this gluconeogenesis will be caused by alpha 1 receptor. Gluconeogenesis will be caused by alpha 1 receptor, but glycogenolysis will be caused by beta 2 receptor. So this beta 2 receptor will cause glycogenolysis and ultimately breakdown of glycogen. When glycogen will be broken down, the amount of glucose will also be released, and it will be released to the circulatory system. Am I clear? These things, all these things are taking place in which condition? In stressful condition or any stressful circumstances. Okay. Now, I want to tell you that if you understand the mechanism, then it will be very easier for you to understand what is happening and why this is happening. Okay, so about alpha 1 and the activity of alpha 1 in the liver, we have understood very easily. The activity of beta 2 in the liver also we have understood very easily. Ultimately, our target is to increase the glucose level in the body, in the circulatory system. So we will do gluconeogenesis, and also we will do glycogenolysis. Now again, what is alpha 2 doing? Alpha 2 is the stimulatory, excitatory or inhibitory receptor. It is the inhibitory receptor. So it will inhibit any function. So what will happen? Again in our body, we needs more glucose. And what is the action of insulin? Insulin, what does insulin do? Insulin decreases the glucose level from the circulatory system. So we need to decrease the insulin level to increase the glucose. To increase glucose, we need to decrease the insulin level. So that's why what will happen in the pancreas. In the pancreas, alpha 2 will show its action. In the pancreas, alpha 2 will show its action, and it will inhibit the formation of glucose. That is, secretion of glucose will be not glucose. Sorry. Secretion of insulin will be takes place. So it will inhibit the secretion of insulin. Am I clear? It will inhibit the secretion of insulin. Which receptor? Alpha 2 receptor. Why alpha 2? Because it is the inhibitory receptor. Am I clear? Okay. Next, another thing is that this adrenergic system is all about stressful circumstance or any dangerous situation. Again, see, for example, a ferocious dog is running behind you. At that time, what you will do? The blood level in your skin will increase or decrease. The blood perfusion in your level in your skin will decrease, because if the dog bites on your leg and the blood perfusion on your skin was increased, then more bleeding will take place. Ultimately, more bleeding will lead to the death. Okay, so we need to decrease, or we need to save more blood, so we need to decrease the blood perfusion from the skin. And if we also decrease the blood perfusion in the skin, then what will happen? Decreasing the blood perfusion in the skin, we can save that blood, and that blood can be transferred to the skeletal muscle, so that we can run or we can fight properly. So skeletal muscle will get more energy and it will easily run or fight against that stressful situation. Am I clear? So in the same way, if the dog bites, then what will happen? Bleeding will take place. One thing we will do is to decrease the bleeding, we will decrease the blood perfusion to the skin. And the second thing what we will do, we will inhibit the histamine secretion. Okay. So ultimately what will happen? In the mast cell, histamine secretion will inhibit. Where these mast cell present? They are mainly present on the lungs. In the lungs, they are mainly present on the alveoli. Okay, so histamine secretion will also be decreased. Next, what will happen? So to stop the bleeding, we need platelet aggregation, or we need the warfarin activity. What is the warfarin activity? Warfarin acts as antiplatelet drug, na? So anticoagulatory drug. So we need anticoagulation, or we need coagulation. We need coagulation. Why? Because if the dog suddenly bites on your leg, then more bleeding will take place. To save the blood, so to save the blood, or to save the body from bleeding, what we have to do? We have to activate the coagulatory system. For that, platelet aggregation will also increase. So in the platelet cell, what will happen? This alpha 2 will increase the platelet aggregation. But where? On the injurious, or on the injured cell. On the injured cell. But here you have to remember one thing. This alpha 2 is always doing the inhibitory action. So this alpha 2 is inhibiting the platelet aggregation. So this platelet aggregation is inhibited mainly on the vascular system. In the vascular system, if platelet aggregation takes place, then what will happen? It will lead to the arteriosclerosis, atherosclerosis, or cardiac arrest, or anything like this. Even heart failure also sometimes takes place due to the platelet aggregations. Why? Due to the platelets, the blood is unable to flow and it is unable to go to the organ. Okay, so platelet aggregation will be inhibiting here. Why it is inhibiting? To save, to increase the blood flow and to save the body. To increase the blood flow, platelet aggregation will be inhibiting. In which part? In the vascular system part. Okay, am I clear? So if the less platelet aggregation is taking place, at that moment what will happen? The blood flow will be maximum and the blood can flow easily. That's why alpha 2 will cause in decrease in the platelet aggregation. Am I clear? Number 4, in the skeletal muscle. In the skeletal muscle, what we need? We need more energy. Okay, in the skeletal muscle, we need more energy. And also, when we are in any restful situation or any restful condition, our glycogen will be stored, our glucose will be stored in the form of glycogen. Where? In skeletal muscle. So at that time, what will happen? Glycogenolysis is taking place. I'm extremely sorry. Glycogenolysis is taking place. What does it mean? In the stressful situation, we need more energy or more glucose in the skeletal muscle also. So at that moment, what will happen? The glycogenolysis will take place. Genolysis. What that genolysis means? It means that for breakdown of the glycogen will take place. So when the breakdown of the glycogen is taking place, what is happening? Again, the glucose level is increasing on the skeletal muscle. So when the glucose level will increase in the skeletal the skeletal muscle can easily fight against the situation, or it can run, or anything it can do. Like it needs more energy, so energy is fulfilled by breaking down the glycogen. So glycogenolysis will take place and glucose level will increase inside the skeletal muscle. So can you please repeat after me loudly? So what are the activity of the different adrenergic receptor? Number one, ultimately our target is to increase the glucose level in the circulatory system, and that's it. You have to remember that. So how can we increase the glucose level? Number one, if we do the gluconeogenesis, that is, we can formation of glucose will takes place. So ultimately glucose level will increase. If we can do the glycogenolysis, that is breakdown of glycogen, again it will lead to the formation of glucose more. If we decrease the insulin secretion, again what will happen? The glucose level will be more in the circulatory system. If we decrease the histamine secretion, it will save the body from the anaphylactic shock. Okay, again if we decrease the platelet aggregation, what will happen? If we decrease the platelet aggregation, the blood flow will be very smooth and it will be very fluent. Easily the blood can flow. Again, in the skeletal muscle we need more glucose, so glycogenolysis also takes place in the skeletal muscle. Am I clear? Okay, thank you. Now we were proceeding towards the drugs acting on the adrenergic neuron or adrenergic nervous system. So sympathomimetics, what are the sympathomimetics? The drugs or the ligand or the neurotransmitter or the chemicals which are mimicking the sympathetic nervous system, which are stimulating the sympathetic activity, which are supporting the sympathetic activity, which are increasing the sympathetic activity. Okay, so the drugs acting on the adrenoreceptors are called adrenergic drugs, and these are also called sympathomimetics. They are supporting the sympathetic activity. Okay, adrenergic receptor agonist, they are also called, these drugs are also called adrenergic receptor agonist. Now you have to repeat after me, along with me you have to repeat, and you have to remember that what are the different drugs which are acting as a sympathomimetics. Number one, some drugs will be alpha 1 agonist, some drug will be selective alpha 1 or selective alpha 2 agonist, and some drug will be non-selective alpha beta, and some will be beta agonist. So alpha 1 agonist, selective alpha 1 agonist are metazolin. Please repeat after me. Metazolin, xylometazoline, oxymetazoline, ephedrine, phentolamine, methoxamine, and phenylephrine. Alpha 2 selective agonists are clonidine, epraclonidine, guanabans, oxymetazoline, and methylphenidine. Clonidine, epraclonidine. Remember, clonidine, epraclonidine, guanabans, oxymetazoline, methylphenidine. Next, beta 1 selective beta 1 agonists are dobutamine and zemoterol. Now I'll tell you one thing very important and very interesting thing you have to remember. See, this beta 1 is mainly present on the, characteristically this beta 1 is present on the heart. This beta 1 is present on the heart. Yes or no? So this is the heart where the beta 1 is present here. So anytime the heart is unable to pump the enough blood, so what will happen? The pump and the heart is unable to pump enough blood. That means what will happen? It will cause cardiac failure. Yes or no? Cardiac failure. The blood is failed to pump the sufficient blood. So to treat the cardiac failure, we can use dobutamine. It will increase the heart contraction. So when contraction will increase, cardiac output will increase. And when cardiac output will increase, again heart failure will be treated. Number two, you can also use heart tonic. What are the heart tonic? They are digoxin, digitoxin, and they all are natural. Digoxin, digitoxin, yes or no? So that was very interesting thing, that this beta 1 is all totally about heart only. It is related to heart, mainly heart contraction. Now selective beta 2 agonist. Beta 2 agonist are salbutamol, terbutaline, salmeterol, formoterol, ritodrine. This ritodrine I have mentioned, if you remember, not so many people tell about this, that this beta 2 is present on the bronchial smooth muscle. Everyone knows that. everyone knows that beta 2 is present on the bronchial smooth muscle, but very few people also knows that this beta 2 is also present on the uterine muscle, uterine smooth muscle. So what will happen? Sometimes, have you ever heard about the preeclampsia? What is preeclampsia? Preeclampsia is the premature labor pain. Sorry, pre-delivery labor pain. So before the delivery, pre-delivery, before the delivery, what will happen? The female will experience a chronic and hard contraction of the uterine muscle. So due to the contraction, what will happen? They will feel some cramps and pain sensation, and that will be chronic level. Okay, so to decrease that, what will happen? I have mentioned, if you remember, that this uterine muscle, smooth muscle, contains both alpha 1 also and beta 2 also. This alpha 1 and beta 2 are always in balanced state. Okay, how it is in balanced state? For example, if the woman is not in any condition of pregnancy, at that moment alpha 1 will be more and beta 2 will be less. But again, if the woman is in pregnant condition, at that moment the beta 2 will be more and alpha 1 will be less. So to treat the preeclampsia, what we will do? We will inject some beta 2 agonist, and that beta 2 agonist is that ritodrine. Very very important. Ritodrine is mainly injected to treat the preeclampsia condition before delivery, premature labor pain. Okay, so here the baby will be there. Shift. The baby will be there. Oh, I have drawn it opposite, wrong. With head will be on the downside. Sorry. So this is immature, not completely matured. In that case, contraction will takes place. Contraction of smooth muscle. So to release the contraction of smooth muscle, what will happen? We will inject beta 2 agonist. And that beta 2 agonist is ritodrine. Very, very important. You have to remember that. It is mainly used in the case of preeclampsia. Salbutamol is mainly used in the case of COPD treatment, asthma treatment. Terbutaline also, salmeterol also, they are very common. But ritodrine is little bit uncommon. You have to remember. Okay. Next, we will proceed towards the pharmacological actions of the adrenergic receptor. So what are the pharmacological actions of the adrenergic receptor or adrenergic agonist? Number one, I have already mentioned earlier. These all things we have learned already. So alpha 1 agonist and beta 2 agonist act on the smooth muscle and causes contraction and relaxation respectively. So here we were adding the beta 2 agonist. Why? To relax the smooth muscle. Why the pain sensation takes place? Due to the contraction of the smooth muscle. Now we will give beta 2 agonist, which will cause the relaxation of the smooth muscle, and relaxation of smooth muscle will lead to the easiness or decrease in the preeclampsia symptoms. Okay. So on smooth muscle, alpha 1 agonist and beta 2 agonist causes contraction of smooth muscle and relaxation of smooth muscle respectively. Next, on skeletal muscle, the beta 2 agonist act on the skeletal muscle and causes glycogenolysis. Again, beta 2 agonist, that is clenbuterol, used by the athletes to increase their performance. Okay. Next, on the heart, beta 1 agonist on heart increases the force of contraction. So when they increases the force of contraction, what will happen? Cardiac output will increase. Cardiac output will increase, and this is mainly used in the treatment of cardiac failure. Okay. So heart increases the cardiac output. Next, on the mast cell, what will happen? Beta 2 agonist acts on the mast cell and decrease the histamine secretion. Decrease the histamine secretion. And these things takes place on which part? On the lungs part. On the lungs part. Because the histamine are mainly present on the lungs and other parts also. Okay. Next, this beta 2 agonist acts on the mast cell and decrease the histamine secretion. Also, hence they are used in the treatment of asthma. See, it is related to lungs or not? Yes, it is related to lungs. Next, in this alpha 2 acts on the platelet cell, and alpha 2 agonist acts on the platelet and causes platelet aggregation. It causes platelet aggregation. Okay, next on the liver, what will happen? On the liver, alpha 1 agonist causes gluconeogenesis, ultimately increase the glucose level, and beta 2 agonist on the liver causes glycogenolysis. Again, glycogenolysis also ultimately increase the glucose level. Am I clear? Okay. Next important point is that on pancreas, alpha 2 agonist will act on the pancreas and it will decrease the insulin secretion. Next, on presynaptic nerve terminal, alpha 2 also act, and alpha 2 agonist acts on the presynaptic nerve terminal and causes the decrease of neurotransmitter release, that is noradrenaline release. Next, what are the adverse effect of the adrenergic agonist? For example, number one is hypertension. Why hypertension? Why? Because due to the alpha 1 receptor. So this alpha 1 receptor will cause the contraction of the vascular smooth muscles, VSM, vascular smooth muscle. Contraction of vascular smooth muscle will lead to the vasoconstriction. When vasoconstriction will takes place, the hypertension will also happen. Blood pressure will increase and it will cause hypertension. Number two is hyperglycemia. Why hyperglycemia? Because the glucose level in the circulatory system are increasing, or the glucose are being supplied to the circulatory system from the different parts, that is from the liver or hepatic cell and also from the adipocyte cell. Yes or no? So it will ultimately lead to the increase in glucose also sometimes, that is called hyperglycemia. Number three, it will also cause muscle spasm. Why muscle spasm? Due to the increase in the contraction. Next, number four, it will also cause tachycardia. Why it will cause tachycardia? Because it will increase the force of contraction. Which one? Beta 1 agonist. So beta 1 agonist will increase the force of contraction of heart, which will cause tachycardia. Alpha 1 agonist will increase the contraction of the smooth muscle, which will cause the muscle spasm. And beta 2 will cause the hyperglycemia, because this beta 2 in the liver it will cause glycogenolysis, and again alpha 1 will cause hypertension because of the muscle contraction, smooth muscle contraction. Okay, next, what are the clinical uses? The clinical uses are: number one, noradrenaline or adrenaline are used in the treatment of cardiac arrest. It is used in the treatment of cardiac arrest, and it defects in the cardiac arrest means defect in pumping blood. So when defect in pumping blood will takes place, at that time noradrenaline or adrenaline will used. These will cause the stimulation of the cell and ultimately lead to the more cardiac output. Next, dobutamine. Dobutamine is used in the cardiogenic shock, or it is also called cardiac shock. Just few minutes ago I have also mentioned about that dobutamine is also used in the treatment of heart failure, and it is also used in the treatment of cardiogenic shock, defects in the impulse conduction. Okay, next, xylometazoline. Xylometazoline and oxymetazoline are used in the nasal decongestant. Why? Because they are beta 2 agonist, so nasal decongestant. Next, adrenaline. Adrenaline is used in the anaphylaxis. What is anaphylaxis? You know anaphylactic shock. What is anaphylactic shock? It is the respiratory depression due to the activation of histamine. I have mentioned few minutes ago, histamine is present in the lungs. The activation of histamine will cause the allergic condition, chronic allergic condition, and that chronic allergic condition will cause the anaphylactic shock. In that moment, what will happen? There will be the obstruction in respiratory system. The person is unable to breathe properly. The breathing problem will take place. The oxygen level in the body will also decrease. So that is called respiratory depression. So this respiratory depression is being treated by adrenaline. Next, mirabegron. It is used for the overactive bladder. Next, we will see the salbutamol, terbutaline, salmeterol, formoterol. These all are the beta 2 agonists. These are used in the treatment of asthma and COPD. treatment of asthma and COPD. Next, amphetamine, fenfluramine, it is also called fenfluramine, and methylphenidate. Okay, these are used in the CNS stimulant. These are used as CNS stimulant because these will act on the alpha and beta receptors. Next, anorectics. Anorectics means the drug which will increase the urge of eating. So when eating, anorectics means decrease the urge of eating. So to treatment of the anorectics, we will use the drug like amphetamine and sibutramine. So sibutramine and amphetamine will are the drug which will increase the appetite. Appetite means urge of eating. Next, uterine relaxant. So what will happen? Sometimes some people are unable to urinate properly. At that time, what will happen? There will be the restoration or storage of urine inside the urinary bladder. So uterine relaxant are used in that case to increase the urination and to decrease the urine present inside the stomach. That is, urine outflow will increase. So what are the drugs used in the urine outflow? The drugs which are used in the uterine relaxation. Shut. I'm extremely sorry. Uterine relaxation. That I was thinking something else. I was thinking about uh, urinary bladder. Another condition is there, urinary bladder, which is not mentioned here actually. But here it is mentioned that uterine relaxant. Uterine relaxant are used in the case of preeclampsia. Already I have mentioned earlier. I have explained it very well. What is preeclampsia? Which are the condition? And in that case, how the female patients or the pregnant female are facing problem and what they are experiencing. So see that ritodrine I have mentioned earlier. This ritodrine is very important, which is used in the treatment of preeclampsia. Also isoprene is used, salbutamol is, tarbutamol is, but isoprene, salbutamol, they are used very less. More than that, this ritodrine is used, and this salbutamol and tarbutamol are used in the treatment of COPD mainly. Okay, I'll tell you one aerosol that is called, one aerosol cylinder is there. That cylinder is called, I forgot the name, bro. In that cylinder, that salbutamol is used, filled. Next, we will see alpha adrenergic receptor blockers. So, what are the alpha adrenergic receptor blockers? These are two types. One is non-selective and one is selective. Selective alpha blocker are mainly alpha 1 and alpha 2 blocker. So, selective alpha 1 blocker are prazosin, terazosin, doxazosin. Selective alpha 2 blocker are yohimbine, edoxazosin. Okay. And non-selective alpha 1 and alpha 2 blockers are phenoxybenzamine and phentolamine. Phenoxybenzamine and phentolamine. Selective alpha 2 blockers not used clinically, but they are used in the sexual stimulants in animal. Why? Why they are used in the sexual stimulants in animal? See, when these alpha 2 blockers are used, what does alpha 2 do? The alpha 2 receptor will, wait, I'll show you in a white paper. Okay, I'll show there. So what is happening? See, there is a adrenergic nerve. In that you will see alpha 2 receptor are present here. So when the neurotransmitter noradrenaline or norepinephrine or anything is released, this alpha 2 is taking back. Yes or no? So if we block the alpha 2 receptor, then what will happen? This noradrenaline will not be taking back so easily. It will only be taking back through the carrier protein, and some will also undergo metabolism in the presence of MAO and COMT. But the ultimately what will happen? The noradrenaline level will increase in the body. So when this noradrenaline level will increase, it will cause the high BP, high blood pressure. And when high blood pressure will takes place in the animal, so what will happen? Their penile erection will takes place, because this is mainly related to the blood pressures only. When more blood pressure is there, the erection will also takes place. Okay, so when the erection will takes place, ultimately they will go for mating. So in that case, that alpha 2 inhibitor or alpha 2 blockers are used. Alpha 2 blockers are used in the sexual stimulant in animal. Okay, now
I'll tell you a very, very, very important and interesting point. You have to remember that. What is the point? If we use non-selective alpha blocker in, okay, normally, do you know, already you know it very well that alpha blockers are used in the treatment of hypertension. But which type of alpha blocker? Selective alpha 1 blockers. Selective alpha 1 blockers are used in the treatment of hypertension. Why? Because this alpha 1 is causing the vascular contraction. But if we use alpha 1 blocker, then the vascular contraction will not take place, ultimately leading to the inhibition or decrease of the blood pressure. But if we use non-selective alpha blockers, then what will happen? In that case, there are two conditions. One is alpha 1, one is alpha 2. So what does alpha 1 do? Alpha 1 blocker will cause the vasodilation, no problem. Vasoconstriction will not take place. Why? Because the vasoconstriction was taking place because of the vascular smooth muscle contraction, which was done by alpha 1. But if we block the alpha 1, then there is no vascular smooth muscle contraction, and which lead to there is no vasoconstriction. But this vasoconstriction will not take place. That means vasodilation will be there, or less vasoconstriction will be there, which will be very good for the hypertension treatment. But you have to remember that alpha 2. What was alpha 2 doing? Alpha 2 was taking back the noradrenaline. Now, if we block the alpha 2, then what will happen? The taking back or the automatic reuptake of the noradrenaline will be inhibited. When the automatic reuptake of the noradrenaline will inhibit, ultimately what will happen? Again, noradrenaline level in the body will increase. And when noradrenaline level in the body will increase, what will happen? It will cause the noradrenaline level in body will increase. What will happen? It will cause the cardiac output, increase in cardiac output. And when increase in cardiac output, again blood pressure will increase. So in that case, what will happen? There will be a periodic increase and decrease. That is, fluctuation of the blood pressure is seen. Am I clear? So to prevent or to avoid that fluctuation of the blood pressure, we will use selective alpha 1 antagonist or selective alpha 1 blocker, not the non-selective alpha blocker. Am I clear? Okay. See, so non-selective alpha 1 blocker. Okay, non-selective alpha blocker. So not used in the hypertension because of the fluctuation of the blood. See, it is written here only. Chat. So not used in the hypertension because of the fluctuation of the blood pressure. And see, this is the mechanism written here. Alpha 1 will cause inhibition of alpha 1 receptor will cause the blood vessel relaxation, and due to which what will happen? Decrease the blood pressure. Yes or no? But inhibition of the alpha 2 receptor will cause presynaptic nerve terminal effect on the it will show its action on the presynaptic nerve terminal, and here it will show its action on the blood vessel. So it will show its action on the presynaptic nerve terminal, and what will happen there? The reuptake of the automatic reuptake of the noradrenaline will decrease, which will lead to the increase of the noradrenaline level in the body. And when the noradrenaline level in the body will increase, it will increase the cardiac output. When the cardiac output will increase, it will definitely increase the blood pressure in the body. Am I clear? Yes. So that's why it is contraindicated. So non-selective alpha blockers are contraindicated in the case of hypertension. You have to remember that. Non-selective alpha blockers are contraindicated in the case of hypertension. Okay. Next is phenoxybenzamine. So phenoxybenzamine is blocks alpha receptor irreversibly. That's why it is used in the treatment of pheochromocytoma. So what is pheochromocytoma? Pheochromocytoma is a condition in which the tumor, it is a tumor condition which takes place in the adrenal gland, and mainly in the adrenal medulla portion. So adrenal gland tumor. Actually, you can also say adrenal medulla tumor. So that adrenal gland tumor will be takes place in the adrenal medulla portion. So this condition is called pheochromocytoma, and the treatment of pheochromocytoma is done by using phenoxybenzamine along with the propranolol. phenoxybenzamine along with the propranolol. Okay, so next, non-selective alpha blocker is used in the treatment of pheochromocytoma. So what is pheochromocytoma? Pheochromocytoma. What is pheochromocytoma? It is the adrenal gland tumor. Okay, non-selective alpha blocker used. Now see, phentolamine. This phentolamine blocks the alpha receptor reversibly, and here it blocks the alpha receptor irreversibly. Here it is irreversibly, and here it is reversibly. So irreversibly blocks the alpha 1 receptor by whom? Phenoxybenzamine. Phenoxybenzamine irreversibly blocks the alpha 1 receptor, whereas phentolamine reversibly blocks the alpha 1 receptor. These drugs are used in the treatment of the hypertension with the antihypertensive drugs. Okay, next is tamsulosin. Next is tamsulosin. So what is tamsulosin? Tamsulosin is a alpha blocker. Tamsulosin is a alpha blocker which is used in the benign prostatic hyperplasia. It is used in the treatment of benign prostatic hyperplasia. Now you have to remember one thing, that selective alpha 1 blockers. These selective alpha 1 blockers are used in the treatment of postural hypertension. So what is postural hypertension? Can you please tell me what is postural hypotension? Postural hypotension means if you were sleeping for a longer duration, 5 to 6 hours, and suddenly you wake up from the bed, then what will happen? Due to the gravity, the blood level on the upper part of your body will decrease, and the blood level on the lower part of your body will increase. So at that time, what will happen? You will feel vertigo. Vertigo means your surrounding will be rounding like this. The whole world, you will feel like the whole world is rounding. Okay, so that condition is called vertigo. In Hindi, it is called sargumna. ऐसे ही sargumega. Okay. So, selective alpha 1 blockers are used in the treatment of postural hypertension. Okay. Now, what are the example of selective alpha 1 blockers? They are prazosin, terazosin, doxazosin. Out of that, prazosin has short half-life, and terazosin and doxazosin has long half-life. That's why what will happen? This terazosin and doxazosin will show its action for longer duration, but prazosin will show its action very fast and for shorter duration, whereas terazosin and doxazosin will show their action very slow, but they will show their action for longer duration. Okay. Okay. Next, we are proceeding towards the cholinergic nervous system. So, what are cholinergic nervous system? The nervous system which are totally related to acetylcholines, also known as parasympathetic nervous system. The main neurotransmitter is acetylcholine. So how the synthesis of acetylcholine takes place? When the choline binds with the acetyl coenzyme A in the presence of acetyltransferase, it will form acetylcholine. Again, this acetylcholine undergo metabolism in the presence of cholinesterase enzyme. So in the presence of cholinesterase enzyme, this acetylcholine will convert into choline again. Okay. So now see, two enzymes are involved in the synthesis of acetylcholine and metabolism. They are acetyltransferase and cholinesterase. Acetyltransferase is involved in the synthesis of acetylcholine, whereas cholinesterase is involved in the metabolism of acetylcholine. Okay. Now see, this acetylcholine acts on the receptor called cholinergic receptors. This acetylcholine acts on the receptor called cholinergic receptor. These cholinergic receptors are of two types. One is muscarinic acetylcholine receptor, one is nicotinic acetylcholine receptor. Okay, one is nicotinic acetylcholine receptor, one is muscarinic acetylcholine receptor. This nicotinic acetylcholine receptor belongs to ionotropic receptors. So what are ionotropic receptor? What are G protein couple receptor? What are enzyme link receptor? What are nuclear receptor? I have explained all these things in the last lecture. Okay, so you can understand about the different types of receptor from last lecture. Okay, now this nicotinic receptor belongs to that ionotropic receptor and are present on skeletal muscle junction. This is called neuromuscular junction, and they are also present on the ganglia and brain. So what is ganglia? Ganglia is a group of neuron, already I have mentioned earlier. It's okay, no problem. Now, muscarinic receptor belongs to G protein coupled receptor. So these muscarinic receptor are of 5 type. They are M1, M2, M3, M4, M5. Out of these 5 type, the odd ones are, that is M1, M3 and M5 are excitatory, and the even one are inhibitory. Even one means M2 and M4, they are inhibitory. So M1 and M3 and M5 are excitatory, and M2 and M4 are inhibitory. Okay. Now see what will happen. The M1, M3 and M5, when they are excitatory, and when the activation of M1, M3, M5, out of them any one is activated, the activation of this receptor will cause the activation of phospholipase C. When the activation of phospholipase C will takes place, it will cause the formation of secondary messenger. What are the example of secondary messenger? They are IP3 and DAG. What is IP3? IP3 is inositol triphosphate. And what is DAG? DAG is diacyl glycerol. Okay, so when the secondary messenger will increase, or the formation of secondary messenger will takes place, it will cause the calcium influx. So calcium influx ultimately lead to the increase in the calcium level inside the cell, which will lead to the depolarization, and depolarization will lead to the excitation of the cell. Okay, now see the M2 and M4 mechanism. So M2 and M4 both are called inhibitory receptors. M2 and M4 both are called inhibitory receptors. The inhibitory receptors. Why? Because when these M2 and M4 will activate, it will inhibit the adenylyl cyclase. When it will inhibit the adenylyl cyclase, it will also inhibit the CMP. So inhibition of adenylyl cyclase enzyme will lead to the inhibition of CMP level. So when CMP level will decrease, the potassium efflux will increase. When the potassium efflux will increase, it will cause the inhibition. It will cause the inhibition of the cellular response. Okay, next, one thing you have to remember, that these nicotinic receptors, when stimulated, it will increase the sodium influx, and this sodium influx will lead to the depolarization. Yes or no? Sodium influx will lead to the positive potential generation inside the cell, which will lead to the depolarization, and this depolarization will result in the excitation of the cell. Okay. Now we will see the different class of drugs acting on the cholinergic receptor. First we will see the agonist, and then we will see the antagonist. So number one, muscarinic receptor agonist. They are very simply, we can remember A, B, C. What is A? A is acetylcholine. What is B? B is bethanechol. What is C? C is carbachol, and also methanechol. Now, these acetylcholine, bethanechol, carbachol, methanechol, they all are synthetic esters. These all are synthetic esters. You have to remember that. These all are synthetic esters. And they are direct acting. And they are direct acting. And they are direct acting. They are the synthetic esters and they are direct acting. So acetylcholine, bethanechol, carbachol, methanechol. After that you will see pilocarpine, eracholine, muscarine and oxytrimorine. Out of that, pilocarpine and eracholine both are the natural. Both are natural alkaloids. This pilocarpine is which type of alkaloid? It is imidazole alkaloid. And this eracholine is which type of alkaloid? It is pyridine piperidine alkaloid. Pyridine piperidine alkaloid contains what it contains? Pyridine piperidine alkaloid contains tobacco, lobelia, and areca. And this areca contains eracholine as the chemical constituents. So areca contains eracholine. So this eracholine is found from the areca, leaves of the areca. Areca is the scientific synonym of betel leaves. And pilocarpine is found in the quinazoline alkaloid. Only one pilocarpine is present in the isoquinoline alkaloid, not quinazoline. Extremely sorry, isoquinoline alkaloid. Okay. Next, see, these are eracholine are present on the betel leaves, so it is written here only. Eracholine are present on the betel leaves. So these betel leaves, their scientific synonym is areca. Okay. Now you have to remember that bethanechol we have studied here only. See, bethanechol. B for bethanechol, A for acetylcholine, B for bethanechol, C for carbachol, M for methanechol. Then pilocarpine, eracholine. Then muscarine, oxytrimorine. Out of that, the acetylcholine, bethanechol, carbachol, and methanechol, they are synthetic esters and they are direct acting muscarinic receptor agonist. whereas pilocarpine, eracholine are alkaloids and they are natural alkaloids. Then muscarine and oxytrymorin. Okay, now you have to remember that bethanechol is mixture or combination of the carbachol and methacholine. They are the mixture of carbachol and methacholine. You have to remember that this question was earlier asked in the GPAT examination, the competitive examination question only. So see, it is written here also. Oh shit, it is written. Previous question paper. So bethanechol is mixture of carbachol and methacholine. Okay. Now we will see the location and their activity. So M1, M2, M3, M4, M5. These are the 5 muscarinic receptors. Out of that, M1 is present on the CNS and stomach. M1 is mainly present on the CNS and stomach. M2 is mainly present on the heart. M3 is mainly present on the GIT and exocrine gland. M4 is mainly present on the CNS. M5 is also mainly present on the CNS. Can you please tell me which muscarinic receptors are stimulatory? They are M1, M3, and M5. And which one are inhibitory? They are M2 and M4. So what will happen? This M1, since it is present at the CNS and stomach and it is stimulatory, so it will cause CNS excitation and it is also called acid secretion. Since M2 is inhibitory and it is present on the heart mainly, so it will decrease the force of contraction of heart. Since M3 is stimulatory again and it is present on the GIT and exocrine gland, so it will increase the GI motility and it will also increase the smooth muscle contraction except the blood vessel. It will also increase the smooth muscle contraction except blood vessel. You can also say mainly smooth wait a second, smooth muscle contraction, yes, mainly on the GIT. That's why, because of this, the peristalsis movement and bowel movement of the GIT will increase when you will take any cholinergic drugs. For example, you can say cinetapride, Sintodec, Sintec. These all are the cholinergic drugs. When you will take these drugs, bowel movement will increase, and when bowel movement will increase, it will cause diarrhea. So this diarrhea is an unwanted effect or side effect of the cholinergic drugs. And these drugs are also used in the treatment of constipation. So treatment of constipation is done by cholinergic drugs, and the side effect of cholinergic drugs are diarrhea. Why? Due to the excess bowel movement or excess peristaltic movement, excess movement of the GI smooth muscle. Am I clear? Okay. Next, since M3 is stimulatory and it is present on the exocrine glands also, so it will cause increase the secretion of the exocrine gland. So it will cause the increased exocrine secretion. And what are the glands? They are salivary gland, sweat gland, and lacrimal gland. Next, M4 and N5. So M4 and N5 both will enhance the locomotion. Okay. Next, C, alpha 1 is present on the vascular smooth muscle. Alpha 2 is present on the presynaptic nerve terminal. Beta 1 present on the heart. Beta 2 present on the smooth muscle of lungs and uterus. That is uterine smooth muscle. And beta 3 is present on the adipocyte cell or adipose tissue. Already we have studied so many times, almost 5 to 6 times. Next, we will see the pharmacological action of the muscarinic receptors agonist. Okay, so what are the pharmacological action of the muscarinic receptor agonist? Number one, on smooth muscle, it will cause the contraction of the smooth muscle except for the blood vessel. And this contraction of smooth muscle mainly takes place in the GIT. Yes or no? Just now I have explained so well, which will lead to the diarrhea and which will also used in the treatment of constipation. Next, it leads to the muscle spasm also. So due to the unwanted contraction of the smooth muscle, it will also cause muscle spasm. Next, on GIT, it will increase GI motility. This one, GI motility. Increase in GI motility will lead to the diarrhea and it is also used in the treatment of constipation. Not that one. That one was related to the spasm, muscle spasm. That muscle spasm. Smooth muscle contraction is related to the muscle spasm. Okay. Here GI motility is related to the diarrhea, constipation. Next, it will also increase the acid secretion. On heart, it will decrease the heart contraction. Which one? By M2. Next, on exocrine gland, it will increase the exocrine circulation. Where? Oh, which one? Due to M3 receptor. Next, on pupil, it will also cause pupil contraction and pupillary ciliary muscle contraction. Okay. So you will see your eye. Okay. No problem. This one is the eye. In this, you will see there is pupil. So these pupil are surrounded by radial muscle, sorry, circular pupillary muscle, and along with that you will see some radial muscle. So when the radial muscle contraction will takes place, pupil will also constrict, not constrict, pupil will become flat and constriction of pupil will takes place. But when the radial muscle will relax, the pupil will become slow. Yes or no? This application is mainly used in the treatment of glaucoma. Which type of glaucoma? Mainly used in the treatment of close angle glaucoma. Okay. See, it is written here only. No. What is that? Blockage space between. Yes, 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 yes.
See here. 1 second. What is that?
Fluid produced by the ciliary muscle are called lacrimal fluid. So blockage of space between the iris and the cornea. The fluid will not expel out. That means the fluid will store there. So due to this, the intraocular pressure will increase, and this condition is called glaucoma. This condition, you can also more specifically you can say that this condition is called close angle glaucoma. Okay. Now, what are the adverse effects? Number one is muscle spasm. Already you know, due to the excess muscle contraction, smooth muscle contraction. Number two is bradycardia. Why bradycardia? Due to the decrease in the cardiac rhythm or cardiac rate, heart rate. Next is diarrhea. Why diarrhea? Due to the increase in gastric motility. Next, peptic ulcer. Why peptic ulcer? Due to increase in the gastric juice secretion or any exocrine secretion.
Am I clear? Okay. Up to this, the adverse effect of the cholinergic drug
completed. Now we will see the clinical use. Number one, pilocarpine. Very, very important. Pilocarpine is an example of which type of alkaloid?
Pilocarpine is an example of isoquinoline alkaloid. So this is a sympathomimetic, but what it is written here, symptotic, something is written. This is totally wrong. You should write there sympathomimetic. So pilocarpine is a direct acting sympathomimetic.
And this drug is, it is the drug of choice in the treatment of glaucoma. It is the drug of choice in the treatment of glaucoma. So increase in the intraocular pressure will be treated by using the pilocarpine, decrease the intraocular pressure. Am I clear? Why? Due to the drainage of the
Drainage of the lacrimal fluid. Okay. Next, bethanechol. Bethanechol is also used in the treatment of bladder emptying. Yes, that's what I was telling at that time. Bladder emptying. This bladder emptying, why it takes place? Some people are having urine retention in their urinary bladder. So to blank or to remove out, expel out the urine, ultimately to increase the urine flow, what will happen? We will use bethanechol. Okay. So that uterine contraction, uterine relaxation, I was telling that only by mistake. Actually, I was not focusing. Okay, it's okay, no problem. Next, muscarinic acetylcholine receptors blocker. So what are the muscarinic acetylcholine receptor blocker? They are atropine, hyoscine. They are atropine, hyoscine, ipratropium bromide, and tiotropium, cyclopentolate, tropicamide, oxybutyrine, tolterodine, trihexyphenidyl, proxyclidine, bipyridine, propanthelin, dicyclamine, isopropamide, nalthamide. Out of that, this for tertiary, quaternary and tertiary amine, these are very very important. You have to remember. So the question will be asked like this: which one of the following is an example of quaternary ammonium compound and is an example of muscarinic acetylcholine receptor blocker?
So the muscarinic acetylcholine receptor blocker, which is having quaternary ammonium compound, is propanthelin. And muscarinic acetylcholine receptor blocker, which is having a tertiary amine, is called diacyclamine. Okay. Next, pharmacological action of the muscarinic acetylcholine receptor blockers. Number one, on smooth muscle relaxation. On GIT, decrease GI motility. And it also increase the force of contraction of heart, decrease the exocrine section, ultimately totally opposite of the agonist, muscarinic agonist. Okay, so it will also decrease the exocrine secretion, mainly which exocrine? Lacrimal, sweat, and salivary. Okay, next, atropine on high dose causes CNS excitation and respiratory depression. That is, this condition is called atropine toxicity, and this atropine toxicity or atropine poisoning is inhibited or it is treated by using physostigmine. So the physostigmine is an antidote for atropine toxicity. Physostigmine is an antidote for atropine toxicity. Next is pupil dilation. Pupil dilation is also the action of parasympatholitics or cholinergic antagonist. Next, what are the adverse effects? The adverse effects are: number one, sensation of the thirst. Why? Due to the dryness of the mouth. Since the salivary secretion will decrease, it will cause the dryness of the mouth, and this, due to the dryness of the mouth, the person will feel sensation of thirst. Next, urinary retention. Next, constipation. Next, blood vision. Already I hope you understand that very well. Why constipation? Due to decrease in gastric motility. Why urinary retention? Due to decrease in the urinary contraction and urinary retention. Next, blood vision. Why blood vision? Due to the pupil dilation. Why pupil dilation? This pupil dilation condition is also called mydriasis. This pupillary dilation is also called mydriasis. This condition is called mydriasis. Okay. Next, you will see very important clinical uses. There, atropine is used in the sinus bradycardia. Hyoscine is used in the motion sickness. Ipratropium and tiotropium bromide. Ipratropium bromide and tiotropium bromide is used in the treatment of asthma. Cyclopentolate and tropicamide is used in the treatment of mydriatics. Sorry, these drugs are mydriatics drugs, and they are used in the eye drops. And these drugs are used mainly by the ophthalmological doctors or ophthalmologist before the examination of eye or before the checking of eye. What happened? Why? Yes. So what will they do? They will do the mydriasis. Mydriasis means dilation of pupil. So earlier the pupil is like this, but after using the drug, it will be like this. So pupil will dilate. So this dilation of pupil will become easier for the ophthalmological doctors to check the eyes properly. Okay, so these drugs, cyclopentolate and tropicamide, are used by the ophthalmological doctors. Okay, next is oxybutyrine and tolterodine. So these are the bladder relaxant, and they are used in the treatment of urine retention. Okay, next, dicyclomine. Dicyclomine is a tertiary amine, and propathyline. Propathyline is a quaternary ammonium compound. Okay, you have to remember this is used as antispasmodic. Next is valethamite, and propylethylene and valethamite are antispasmodic and anti-secretory. But the most important point you have to remember about these three drugs: trihexyphenidyl, bipyridine, and procyclidine. So trihexyphenidyl, bipyridine, and procyclidine are used in the treatment of Parkinsonism. Antimuscarinic used in the Parkinsonism. Okay. So Parkinsonism is the disease or it is a symptom. Why it takes place? It takes place due to the increase in the acetylcholine level. So when antimuscarinic drug will be used, what will happen? It will decrease the acetylcholine level, and when acetylcholine level is decreased, Parkinsonism will also be treated very easily. Okay. So next is nicotinic acetylcholine receptor agonist. So what are the nicotinic acetylcholine receptor agonist? They are acetylcholine nicotine, lobeline, epibetidine, and dimethyl piperazinium. This lobeline is the nicotine inhibitor.
Okay, have you remember I have mentioned earlier about the piperidine alkaloids in which tobacco lobelia was there. That lobelia contains this lobeline. Okay, it is also the ganglionic stimulant. These drugs acting on the nicotinic acetylcholine present in ganglia, and it will increase the salivary secretion, it will increase the gastric motility, it will increase the muscle spasm. Okay, next nicotinic acetylcholine receptor blockers. They are hexamethonium and trimethophan. So hexamethonium and trimethophan. They blocks the nicotinic acetylcholine receptors in ganglia. Nicotinic acetylcholine receptors in ganglia. So after blocking of nicotinic acetylcholine receptors in ganglia, what will happen? This activity will be reversed. This activity will be reversed. So before increase salivary secretion was more, now salivary secretion will be less. GI motility was more, now it will be less. Muscle spasm was more, now it will also less. So decrease salivary secretion, decrease GI motility, decrease muscle contraction. Am I clear? So very easily you can remember all these things. Okay. Yes or no? You have to note one thing. It is very important to remember that trimethophan Trimethophan is used to lower the blood pressure during surgery. So trimethophan is used to lower the blood pressure during surgery. Trimethophan is used to lower the blood pressure during surgery. Okay, next neuromuscular junction blocker, that is NMJ blocker. Neuromuscular junction blocker, that is NMJ blocker. Okay, so what are the neuromuscular junction blockers? These what are they do? These blockers block the nicotinic acetylcholine receptor at the skeletal muscle or neuron junction. Skeletal muscle or neuron junction. What they will do? They will have non-depolarizing. They are of two types. One is non-depolarizing blocker, one is depolarizing blocker. Non-depolarizing blockers and depolarizing blockers. Depolarizing blockers are those which will block or inhibit the depolarization, and non-depolarizing blockers are those which will block or inhibit the neuromuscular junction activation in different way. So the examples are tibocurarin, pencurarin, tibocurarin, pencurarin, atacurarin, mivacurarin, and vecuronium. So they are tibocurarin, pencuronium, atracuronium, mivacuronium, and vecuronium. And depolarizing blockers are succinylmethonium, decamethonium, and succinylcholine. And these drugs are used as skeletal muscle relaxant. Used as skeletal muscle relaxant. Am I clear? Okay. Next, we will proceed further. So up to this, it is over. So after that, only 2 pages left, then central nervous system will start. Okay, let's complete that. So the release of acetylcholine, how acetylcholine is released? See, in the neuron or nerve cell, choline will be choline and acetyl CoA will be binding together. In the presence of acetyltransferase, it will form acetylcholine. These acetylcholine are stored in the vessels, and these are called acetylcholine is stored in vesicles. So these vesicles are called store vesicles. So when the entry of calcium ion will takes place, okay, this is the cell membrane. This is the cell membrane, and this is the channel. So this through this channel, what will happen? Entry of calcium channel, entry of calcium ion will takes place. When the calcium ion will enter, what will happen? Depolarization will takes place. Due to that depolarization, what will happen? That vesicles will activate and it will come out. Then this acetylcholine comes out in the synapse. From that synapse, what will happen? The cholinesterase enzyme will metabolize some of the acetylcholine, and some acetylcholine will convert into choline, and that choline will again be reuptaken through the carrier protein, and some acetylcholine will be automatic reuptaken through that nicotinic acetylcholine receptors. Okay, this part is called post-ganglionic part, no, post-synaptic neuron part, and this part is called presynaptic neuron part. In between there is synapse present. This part is the synapse part. Okay, now the most important point you have to remember is that exception. Here acetylcholine will increase the excitatory. Acetylcholine also acts on the presynaptic neuron, non-depolarizing blockers and depolarizing blockers. So these non-depolarizing blockers and depolarizing blockers both will act on the nicotinic acetylcholine receptors. Okay. After that, when the acetylcholine will bind to the post-synaptic receptors, they will show their action, further action. That is, increase the sodium influx or calcium influx, which will lead to the depolarization again, and that depolarization will further lead to the excitation. That depolarization will further lead to the excitation. Okay, so you have to remember that. What is that MACHR? MACHR is muscarinic acetylcholine receptor. MACHR is the muscarinic acetylcholine receptor. Okay, now see. Non-depolarizing blockers and depolarizing blockers are used as skeletal muscle relaxant and used along with general anesthetics. Okay, so non-depolarizing blockers and depolarizing blockers are used as skeletal muscle relaxant, and it is used along the general anesthetics. Okay, next anticholinergics. So what are anticholinergics? These are the cholinergic. These are anticholinesterase, means they will inhibit the cholinesterase enzyme and decrease the acetylcholine metabolism, and they will increase the acetylcholine level in the body. So drugs which inhibit the cholinesterase enzyme, drug which inhibit the cholinesterase and involved in the metabolism of that in cholinesterase which is involved in the metabolism of acetylcholine, and ultimately what will happen, they will lead to the increase in the acetylcholine level. Okay, they are of three types. Number one is short acting, medium acting, long acting. Short acting acetylcholinesterase are cholinesterase inhibitor, that is anticholinesterase. Short acting anticholinesterase are edrophonium. Edrophonium. I'll tell you one thing. You will find now something related to the myasthenia gravis, treatment of myasthenia gravis. Okay, so edrophonium. Then medium acting is physostigmine, neostigmine, and pyridostigmine, and long acting is ethiocapate. Ethocyopate, but it is written ethiopate, ecothiopate. It's ecothiopate. So ecothiopate is a long-acting reversible cholinesterase inhibitor. Edrophonium is having quaternary ammonium compound. Physostigmine is having tertiary ammonium compound or amine compound. Tertiary amine compound. No, neostigmine and pyridostigmine are carbamates. They are example of carbamates. Now see, these long acting are diphosphorothioane and malathion. They all are long acting irreversible bonding. Okay, now you have to remember one thing, mainly most important clinical uses. This one. After that, our ANS will complete. So ecothiopate, first one, used in the treatment of glaucoma, I think. Wait a second, we'll see. Ecothiopate used in myasthenia gravis, in the treatment of myasthenia. See, myasthenia gravis, we already found that. In the treatment of myasthenia gravis. So what is myasthenia gravis? It is an autoimmune disorder related to the muscle. Okay, due to the mutation in nicotinic receptor, not lead to the excitation. Okay, Next, it is also ichthyothioate is also used in the treatment of glaucoma. See, I have mentioned 1 minute ago that ichthyothioate is also used in the treatment of glaucoma. It is very very important because it is long acting. Since it is long acting, it will show the action for a very longer duration. Okay. Next, adrophonium. Adrophonium is used in the treatment of diagnosis of myasthenia gravis. So not treatment, sorry. Adrophonium is used in the diagnosis of myasthenia gravis, whereas neostigmine and pyridostigmine are used in the treatment of myasthenia gravis. So you have to follow focus on that, diagnosis and treatment. So adrophonium is used in the diagnosis of myasthenia gravis, and neostigmine and pyridostigmine are used in the treatment of myasthenia gravis. Okay, used in the treatment and used in the diagnosis. So you have to remember that adrophonium are used in the Adrophonium is used in the diagnosis, whereas neostigmine and pyridostigmine are used in the treatment. Okay, so adrophonium, diagnosis, neostigmine, pyridostigmine, treatment. Treatment of what? Treatment of myasthenia gravis. Treatment of myasthenia gravis. Next, donazepam. No, no, not donazepam. It's donegazil and rivastigmine. Donegazil and rivastigmine are used in the Alzheimer disease. It is used in the Alzheimer disease. So donegazil and rivastigmine used in the Alzheimer disease. Okay. Up to this, our ANS completed. So up to this, our ANS ANS completed. Now we will see the central nervous system on the next class. Okay. Thank you so much. Thank you so much for your thank you so much for watching the video, and please do subscribe and like the video. Okay, please subscribe my account so that I can teach more and more, and I want to teach more. So teaching is my passion, and you people support me and try to improve my and grow my account. Okay, thank you so much.